Good evening, everybody. I'm glad to be back and with Dr. Splaver here. Hey, welcome to our Facebook Live for tonight. How you doing?
Great. Thank you very much for having me. Excited to talk about this exciting program.
Oh, well, we're excited to be talking about you joining us. And tonight I wanted to talk a little bit about, well, how this all happened. Well, first of all, why don't you tell us a little bit about yourself?
So my name is Dr. Adam Splaver. I'm boarded in internal medicine, cardiology, nuclear cardiology, echocardiography, age management medicine, and vascular interpretation of ultrasound. I have a special interest in the holistic aspect of medicine, taking in mind, body, and spirit. And I've been practicing for 15 years in Hollywood, Florida, now located up in New York.
Great. So, Adam, or should I call you Dr. Splaver? Is Adam okay? Or?
Either way is fine.
All right. Well, it's kind of serendipitous how you ended up getting to talk to us and see us. And, a friend of yours came in first. So why don't you kind of tell us a little bit about, your friend's story?
Yeah, exactly. It's quite interesting. I have a dear friend of mine, and she was suffering for years with depression, anxiety, having sleep issues. At one point, even it came to the point where she had suicidal ideation. She felt like she was going to kill herself. And she had been through multiple different treatment modalities, cognitive behavioral therapy, cognitive dialectical therapy, rapid release therapy, somatic experience therapy, multiple medications, and all really didn't seem to work for her. And then she came across Pathwaves or neurofeedback. And what was amazing, and I was able to see the change in her dramatically after literally a number of sessions. She was off of her medications. She was sleeping through the night, wasn't depressed, and seemed a lot more centered, a lot more focused after going through your program. And as a clinician, as a doctor, initially I was a little bit skeptical because I'm trained to give medication. I'm trained to go through the traditional route of therapy, of the time and true, resources that we've all been told are cure-alls or treatments for these ailments. And once I saw for myself how remarkable change she had in her life, I said, okay, I know I've had some sleep issues. I've had some concentration issues. Especially since COVID and since everything that's gone down here in America, I said, let me give it a try. Let me see what's going on here. And I went through my sessions, and remarkably, I saw an increase in concentration. I saw my sleep patterns actually quite improved, and my mood actually was elevated. So the proof is in the pudding. After seeing, not only a dear friend go through this and have her life change remarkably, but mine as well. Dramatically improved after going through the Pathwaves program.
Well, thank you for sharing all that. It's nice to once again hear. I hear those kinds of stories all the time. We've been doing this since 2008, and I just can't tell you how many times. I've had people who have tried everything that come in, and they don't get a lot of results from all the things they've tried, and they come into me. I've actually had people say, "Hey, if this doesn't work, I'm done. I'm just going to quit." And I'm like, "What do you mean?" They're like, "Well, life in general, And, I'm happy to say they're all living now and living happy, healthier lives. And it's fantastic. The first thing we do, people come in, is we begin by doing a QEEG. That's the medical term for it. And basically, it's a quantitative measurement of the neurological activity that comes in and out of the brain. And we're able to, because of all the work that we've done with doctors and psychiatrists and psychologists, to basically reverse engineer that neuro information, all that the nervous system data, and be able to tell people how they feel and function and why. And that's what a great beginning, because
it's a remarkable marriage of science and psychology and neurology. So it's a beautiful process that entrains the brain, that teaches the brain how to function at a higher level, how to snap itself out of the lower vibrational or the lower thought processes that make people depressed or anxious or have sleep disturbances.
And we also teach the client how to be more in charge of their own mood, which is so important, right? All the psychological training and coaching that we actually educate so they can be aware of, hey, how their thinking actually changes their nervous system.
Correct. It's a beautiful program that you've created and really have spearheaded and fine-tuned, allowing not only for the coaching, but also for the neurofeedback sessions, which are highly instrumental in making such big life changes.
Yeah. So have you been involved with neurofeedback locations and other places before?
No, this is actually, believe it or not, has been the first my first go around with it on a personal level, but I've read about it and I've learned about it, and the science is quite remarkable. In training the brain to at least function at a higher wavelength, at a higher frequency, to allow for better feelings, better state of mood, of sleep, of concentration, and even performance, allowing people to concentrate even better.
So yeah, and what we do at Pathways with the neurofeedback is very different than what's available really in the marketplace. And this is one of the reasons why I wanted to invite you to join the team, is that we can medically be tracking how people are doing and showing the biological responses that are happening. And so in the near future, working with you, and we're also going to be on the track to be able to take insurance, and also for the high end patients that come in, we're going to be implementing a max health path, is what we're calling it, where Dr. Splaver will do a complete evaluation in the beginning and help with their medical care and their treatment, as well as what they're doing with Pathways.
Correct, because it is a marriage of biology as well as psychology and neurology.
Well, we happen to be both as people, so I think it's probably pretty important that we treat
more than blood and neurotransmitters and hormones. There is a spirit, there is a psyche, there is a thinking human being behind all of this. So it's beautiful.
And that seems to be the least understood part of the equation. And I think that at Pathways, we're kind of we're getting a lot closer to being able to not define it, but I like to say we've cracked the code.
I think you come
we can. Okay.
I think you guys have really quite remarkably tapped into it, and it's amazing because if you look at the science, if you look at the data, for lack of better terms, a lot of the medications that us doctors prescribe really don't get to the root cause, don't get to the initiative factors that make people go into that spiral, make people anxious, make people depressed, have these sleep disturbances. And once you're able to at least then go into the neurology, go into the electrical activity of the brain, the psyche of the brain, then you can actually reverse a lot of these issues without using the medications, without using these pharmaceuticals that have their own negative impacts on people's lives.
There's two things that come up for me when you say that. One of them is, it's kind of hard to tell because of the dynamic, right? It's we start to think a certain way, and then our body changes to automatically give us that function. And so even if we want to stop thinking that way, since our body has changed, now it's just part of how we think, because our body's automatically creating those, I don't know if you want to call them thoughts, but neurological signaling, which causes the thoughts. Mm-hmm. Even if we want to change it, now our body's trained to make us do it. It's such an interesting dynamic, and so it's not, I always want, is it the chicken or the egg thing? It's kind of like they reverse roles, right? Yeah. We start thinking away in our mind, and then our body takes over and starts making us do it. And correct. And that's why I think it's so important for us to treat both at the same time instead of just treating one or the other.
It's really taking a comprehensive approach towards psychological and mental well-being, looking at the physical, mental, spiritual, emotional aspects of the human being. And only by doing so can you really create a successful program like that you have and the team has down at Pathwaves.
Well, we're glad that you're going to be joining us and
Same here. Same here.
helping move forward and really helping. I liked what you were saying earlier about elevating and living from a higher plane of existence. And I think it begets a little bit of a conversation about, a lot of the classic medical and neurofeedback work is to help us really hit that first standard deviation, which they call normal functioning, which actually embodies the typical survival animal instincts, which is what we're trying to help people rise above.
Correct, because normal is average.
Right.
Who wants to be normal? You want to be super normal. You want to be above average. You want to be functioning at your highest possible ability. And by tapping into this unique, novel, and really exciting science, can you actually achieve those goals and go beyond?
Well, I've been working on it for a long time, and we've built the standardized program so that we can move forward, and eventually, working with you to be able to have insurance accept us in Medicare and Medicaid, I really think is going to help expand the access to our phenomenal program. And I also think I should probably mention you look a lot more attractive now too. So it also
helps. Thank you. You're not my type. But
no, I'm just,
yeah, I know.
A lot of people's skin actually they're getting more oxygen and they're less tense. So
well, there's a mind-body connection. We're very very familiar with it, and obviously if there are issues that are affecting your psyche, if issues affecting your mood, it affects not only neurotransmitters but hormones and how your body functions. So they go hand in hand, and by dealing with these issues, you can actually create a better, healthy individual and a more focused individual. So it's not a matter of only just function; it's also form.
I'm sorry, what was the last thing you said? It's also what?
It's not only function, but it's also form.
Form? I don't understand. What do you mean?
Well, the physical body, the actual ability to change your thought processes actually have a physical effect on the hormones and other chemicals that are going through your body, so you actually function in a biological way in a more optimal state.
Right. So we're changing the body.
Correct.
Without doing surgery or taking meds.
No knives needed.
That sounds really exciting.
Yes.
So any closing thoughts? Anything beyond what we've said tonight?
The bottom line that it's really exciting that this is going to be accessible to the multitudes through insurance, and through doing a detailed analysis prior to actually entering the program. Can the program be tailored, fine-tuned, and basically customized to your experience and what you're trying to achieve through the program, whether it be as you mentioned before, treating depression, anxiety, post-traumatic stress disorder, addictions. All of those things are definitely indications for this type of program, but also for the executives who wish to optimize their performance, to optimize their awareness, their concentration, their focus. Really is an exciting tool that hopefully will be more available to the masses.
All right. Well, fantastic. I am looking forward to working with you more in the future. So
same here.
Everybody, thank you for checking us out tonight, and I'm sure we'll be seeing more of everybody in the future. Have a great night, everybody.
Have an awesome evening. Be well.
Bye.